Welcome to the Scottsdale Vibes podcast. I'm Alicia Haygood. What if your doctor actually had the time to spend with you and it wasn't clocked in at 5 to 7 minutes? You didn't have to wait half an hour to get those 5 to 7 minutes, but it was your time with your doctor. That's what I'm here to talk to you about today with MD2 Concierge Medicine. So we're going to talk about why concierge medicine, personalized healthcare, and why more people are looking for a deeper relationship with their physician. But first, let's check in with Jeremy Mueller of State Farm Insurance. Giving back to the community is a top priority for Jeremy and his team. He's been here for over 25 years, helping neighbors just like you with home, auto, life, and business coverage. He knows our city, our lifestyle, and our needs. Plus, with 3 local offices, help is always close by. Give Jeremy and his team a call at 480-515-5223 or visit him on the web at jeremymueller.com because here we look out for one another. So let's dive into the topic that so many people are curious about right now, and that is concierge medicine. It really is taking off in the healthcare industry. If you've ever felt rushed through a doctor's appointment, waited weeks or months to get in, or struggled to navigate the healthcare system, I am guilty of all of those things. Today's conversation is really going to be for you and I. So MD2 recently opened its Scottsdale practice right here in McCormick Ranch and is bringing a very different approach to healthcare. Their physicians care for only 50 families at a time, allowing for same-day appointments, deeply personalized care, and a true partnership when it comes to our health and wellness. So joining me today is Dr. Bithika Thompson, a highly respected physician who spent more than a decade at the Mayo Clinic here in Arizona and previously served as the chair of Department of Endocrinology. She is nationally recognized for her work in diabetes, endocrinology, and patient-centered care, and now is helping bring MD2's concierge model to Scottsdale, along with her partner, Dr. Leslie Thomas. So Dr. Thompson, thank you so much for coming with us. I'm avoiding my healthcare email admin task list right now because it's such a pain in the you-know-what to deal with.
It is.
And you are a doctor and have to deal with it more than I do, so I can only imagine. This really is taking off on the concierge approach. So talk to me as someone who's been in the profession for decades and how you personally wanted to take this switch.
Yeah, absolutely. So first of all, thank you for having me here today. It's not surprising because it is a very appealing approach to medical care for a patient. You know, it's very, we've all kind of dealt with the difficulty of, getting a hold of our doctor, getting an appointment, and even just the, mental energy that goes into having to call to make that appointment.
Yes, I avoid it.
It's daunting. You know what I mean?
Yes.
It becomes very, very difficult. So I think that, the appeal of being able to reach your doctor, knowing that you're not rushed, that you can spend as much time. You don't have to get it all out there in 10 or 15 minutes because that's all the time you have,
right.
And knowing that, you're not bothering your doctor. You can reach out to them with a simple question. You can always get a hold of them. It's very appealing to people,
Yeah.
So it's not a surprise that it's becoming more popular.
What are you seeing from a doctor's perspective, working in, the Mayo Clinic, this big corporate, healthcare system, to working with individualized patients in this? As a professional, how are you feeling about this?
Yeah, so my partner and I, Dr. Leslie Thomas and I, we're both at Mayo Clinic here in Scottsdale for 12 to 15 years together. We loved it. It was a great experience. We love working at the Mayo Clinic. It's a fantastic institution. Yeah. Our main appeal, I think, for starting this practice was just our desire to spend more time with patients. I think all doctors
it's so
rushed.
simple, makes so much sense, right?
Yeah, we're all rushed. You know what I mean? And so I think, when we thought about it, we started thinking about it a couple years ago. The idea was that we really love seeing our patients. We would love to get to know them on a more personal level. We would love to, spend time with them and not feel rushed and really have the opportunity to not just kind of deal with the acute issues, but have the ability to kind of take care of those things, but then really be more proactive, right?
Yeah.
I mean, really be able to spend time with someone and figure out, we can treat this, but what can we do to help you live longer? What can we do to help you be healthy? You know what I mean? What can we do to prevent illness, right? So, so it really gives us that unique opportunity, and that was the appeal. The appeal was, how can we really begin to enjoy being a doctor again, feeling like you're taking care of someone. You know what I mean? We like to think of it, we always talk about this together, when we were thinking about the practice, and we talk to our patients about how we want them to feel like they are a family member. We want to take care of them like it would be me taking care of my mother or my father or my sister, right? We don't want them to hesitate to reach out to us because they would call us up if there was a problem, if it was a family member. We want to be able to be there for them. If it means going to an appointment with them because they are nervous, if it means calling up another doctor to ask them a question, if it means seeing them emergently, going to their house to make a house call because they can't get to the office. We would do all of those things that we would do for our own family members.
Yeah. Because they are family at that point.
Absolutely, yeah.
So before we get into the details a little bit more, talk to me about MD squared specifically and what was so appealing to you and Dr. Leslie Thomas about really going with this and their care of concept.
Absolutely, yeah. Well, I think that there's two things that I think are appealing to us, mostly because they're very appealing to patients. And we really want to have this wonderful relationship with our patients. The first is that the MD squared model is committed to keeping that one physician for 50 families.
Yeah.
Okay, and that's a really big deal. When you think about that, it means that at most, I am going to have maybe 100 patients that I'm taking care of.
Okay, now put that in comparison to someone who's never been a doctor and doesn't have any patients. How is that different from working at Mayo Clinic or in other offices?
So, it's very normal if you look across the board. Any primary care physician or specialty physician, has thousands and thousands of patients that they're caring for, at any given time. So this is a huge difference.
It is that thousands. Okay.
Yes, thousands. Easily 2,000-3,000 patients would be normal.
Wow.
When you think about other concierge models, it also differs from that because when we think about other concierge practices, they do limit patients, but they're still taking care of anywhere usually between 300, 500 patients. So this is a significant decrease in the amount of patients that we're caring for at any given time.
Okay. I didn't understand that, the numbers.
Yeah.
Okay.
So what it means to me and to you, as the patient, is that when you call me up, I look at my phone and I see your name and I know who you are and I know everything about you and I don't have to look you up and I know what's happening with you and what's going on in your life because that's how well I know you. So I pick up the phone and
family.
I know exactly what's going on. You know what I mean? And I know that you had this appointment last week and what you want to talk about. And it's very easy because I know my patients so well.
Yeah.
And because you develop that relationship, it's also really exciting. Like when my phone rings and I look to see who it is and I say, oh, so and so is calling me today, and it's it's fun. It's more fun, to talk to someone when you're less rushed and you have more time for them and you really know that you can help them.
Yeah. Listen, when we go book appointments online, you see the 15-minute increments.
It's crazy.
Of like what you're going to get on your Calendly invite kind of thing, right?
Exactly.
It's nuts.
It's nuts.
Let's talk about the kind of services you provide because you do have an endocrinology Mayo background, but that's not what you're specializing for MD squared. It can be anything. So kind of what do you offer?
Yes. So Dr. Thomas and I are both internal medicine trained. So we are boarded in internal medicine. And we have specializations, myself in endocrinology and Dr. Thomas in nephrology. So I think of it as, internal medicine doctors can become specialists, and so we have specialized training, but we are internal medicine doctors. We are taking care of patients as internal medicine physicians, and so
age.
Oh, any age. I have patients of all ages. I've got 20-year-old patients, 30, 40, all the way up to 80 in their 80s.
Children?
So we do take care of children of patients that's included in that family, but not young children. You know what I mean? So adult children.
Okay. Makes sense. Okay. To continue on from there. So we have the 50 patients, what you have access to you do internal medicine. I want to talk about preventative versus, being ill. You mentioned that before, the importance of that. Because at the end of the day, I feel like as a doctor, you really want to see us less, the healthier that we are and the better life we're living in that sense.
Yeah.
How do you work that into your practice?
Yeah, it's a great question. So, starting with a patient, it's very common that the first time I would see someone, this is going to blow your mind, but I could easily spend 3 to 4 hours in the office with that patient. Okay, so I saw a new patient on Monday. She was lovely. I spent about 4 hours with her in the office, really going through every little bit of her care. We do a lot of things in our office, so we draw blood, we have an x-ray machine if we need to use that, we do a lot of screening, we do a body analysis, vision screening, hearing screening, we do a spirometry analysis of breathing. We do all of that in our office, so that is all included. So we do a very full evaluation, full physical exam. And we come up with plans to address, obviously, the acute issues, but also plans to, address the preventive issues. And we were able to actually talk about goals. Like, what are the things you want to do? Like, what would you like to see? What are your goals? I've even in all my years of, caring for patients and wanting to address their goals, it's so hard because you only have 15 minutes, right? So you really
can't do anything.
You can't. I mean, you really can only address the immediate things, and so we kind of cover all that at first, and it's interesting because we often find new things that we're that we're having to deal with, or things that may not come up initially. Like if I was seeing them and I knew I only had 15 minutes, I might kind of say, well, this is not the most important thing.
Yeah.
We won't address it.
Prioritize
You know what I mean?
it, yeah.
It's not, it's not something we have to deal with now. But now I can look at those things and say, this looks, it's not a problem yet, but it's different than it was a few years ago. Why don't we think about that? You know what I mean? Why don't we think about what we can do to maybe prevent this from happening 5 years from now, right? It's a completely different approach because we're not limited by time. And so we can really do that. And I have the ability as the physician, not only can I make a recommendation, but someone tells you to do something, I'm guilty of this, and I say, yes, I'll do it. And then I go back 3 months later and they say, did you do it? And I said, no, I didn't do it. I'm
Listen,
busy.
the dentist, how many times do you not floss?
Oh, the dentist. Yes, flossing. They always ask me. They always ask me if I'm flossing, and I always wish I was doing better, but I'm not, right? It's just impossible. But in our practice, it's kind of nice because if patients are motivated, or I say like, I really would like you to start checking your blood pressure a couple times a week, I can check in with them in a couple of weeks, and
It's
I can say,
accountability.
hey, yes, are you doing that? What does it look like? Like, are you, it really helps patients become more motivated for themselves, because they have a teammate, they have they have an advocate, they have a friend, they have a family member who is wanting them to do better.
Yeah.
So it is a really unique relationship.
Are you finding more patients are calling you with I'm sick and I can't get in my doctor urgent care, let me start with you, and then you go from there? How is this working for you with the patients?
It's really interesting. That's a great question. We have found in the last 4 months as we've been taking patients that all patients have a different reason for wanting a concierge doctor. And there usually is a reason. You know what I mean? There's something that has happened. Sometimes it's like that. Like a patient says, something bad happened and I went to urgent care and it was really difficult, or I couldn't get in to see a primary and it just seemed unnecessary that I had to go through all this hassle for days before I could get a medicine or something like that. And so there's an event that kind of, sparks it, where they realize that the medical system is more difficult than they anticipated, and they start to worry about, having access to a doctor if they need it. So that's one reason. Some people are really just wanting the assurance of being able to reach someone when they need them. You know what I mean?
Yes.
Which makes a lot of sense, and that's a big reason. It's also very appealing, I would say, to people that are incredibly busy, and really want the efficiency and just knowing that, they don't have to, that they can call and say, I need to be seen today for this, or could you send this in right now? And they know that it's going to happen because they just are so busy that they can't plan ahead, or they don't know where they're going to be, like that. And then lastly, it's really appealing for people that travel a lot,
I was going to ask that. Yeah, I can only imagine. And that's huge here in the Valley.
Absolutely.
I mean, we have travelers, we have snowbirds. How does that work? Because I think this is a perfect place for our community and our residents is for something like this.
Yeah, so when people travel a lot, I mean, they worry, I'm going to be gone for 3 months in the summer, and what if something happens to me in Seattle? It's like, well, it's not a problem. I mean, for one, I'm always accessible. If something happened to you there, you would call me. I would work with your doctors there. If you had to go to the hospital, if you needed to see a specialist, I would find you one there. We would help you with that.
Okay.
So all those things are very easy, even from afar.
For you, right?
Right.
For us, we're terrified.
Right. So they're not ever alone. You're never left alone. You always have your doctor there to help you. So that's very reassuring. We also, I think, appeal to a lot of people who travel because we have about 40 kind of satellite offices. We're all separate, but we have MD squared offices across the country. And so, for example, if I had a patient traveling in Seattle, we have a Seattle office. And, if something happened and they needed to be seen and it wasn't needing to be seen in the emergency room, I would just send them to my friends over in Seattle and say, hey,
Genius.
Stop by their office, have them take a look at your ear, see if you have an ear infection. and they would talk to me about it. And we do the same for all of our families that come to visit us, in the winter here in Scottsdale.
Yeah, I love that.
Yeah, so that's very nice.
Advocacy, patient advocacy is a huge downfall, I think, as a whole in the medical field, and it's nothing to do with the doctors. Y'all are overwhelmed, right?
Absolutely.
Same with teachers, right? You're just overwhelmed.
Yes.
Talk about the advocacy that you get to have for these patients. You kind of mentioned it when people get sick. I'll call the hospital and talk to them and stuff like that. Again, that's a piece of reassurance.
It is.
If I'm not in my right mind and something happened, to know that someone genuinely knows my medical background.
Yes. Yeah. No, that's a great point. I'll tell you, I've always considered myself to be a very strong patient advocate, and I've never been able to do it as well as I'm doing now. You know what I mean? And it's because I have the opportunity. So like you said, to your point, doctors want to advocate for their patients, but they are
I feel like that's why you got into the profession to begin with.
But they are limited by, the environment that they're working in and the stresses there. So, the couple things come to mind when I think about that. I mean, the first is that, a lot of times people go to appointments, it's like I think about myself with my car. I don't understand anything about my car, okay? I just don't. I don't understand anything about it. And I'm sure I'm not doing things right and so forth. But people go to their appointments, and sometimes they don't hear what is being said because it's like a completely different language. You know what I mean? They really do not. They're trying to listen, they're trying to understand, but it's overwhelming, and sometimes people are scared when they go to appointments. And so the first thing I would say is that we go a step further. We have the time to attend appointments with patients, and since we opened in February, I've attended. I don't go to all my patient appointments, but ones where they're important and patients want me to show up, I show up, and I've gone to 6 different appointments now.
That's huge.
In the last couple of months, and every single time it was a fantastic experience for me, the patient, and the other physician.
I bet.
I mean, it was a great experience. It really added a lot. What I hear and what the patient hears is very, very different. And when we leave, I can relate that to them. I can spend time talking to them, whereas the other doctor cannot. I can carry out the plan a lot of times to put some relief on that other doctor and their busy schedule, so I can assist in that way, which is really, really helpful.
I didn't think about that,
which is a big deal. And also, it's very hard, that you think about like, I have this question. I left the appointment. Something came up, and it's like impossible to figure out who to talk to. Like, how do I call the office? Do I send a message? Like,
info@doctor.com.
Who am I getting? Like, I mean, is the doctor responding? Is it someone else? Or you have no idea. And so the nice thing too is like, so my patients will call me up and be like, I don't know if this, if I should be on this medicine or what they wanted me to do. I don't remember. And it's not on them anymore because I can help, right? So like, I will call them up. I will call up the doctor. I will call up the office. I will figure out the answer to that question. You know what I mean? So that they don't have to be sitting there at home wondering or worrying about this until their next appointment, right? I mean, it's to give them some relief. We can figure out the answer. It's not a big issue.
What do you think someone that's considering concierge medicine, some questions or pushback that you're seeing as a whole, like, let me settle this for you, and this is a big question I've gotten over and over. Mm-hmm. What are you hearing out there?
Yeah, that's a good question. I'll tell you that my experience has been, when we see patients and we try to figure out if they're a good fit for our practice, sometimes there's a little bit of skepticism, but I'll tell you that every time a patient joins, it goes away almost instantly. Do you know what I mean? And usually what happens is that someone joins and then they say, I'd like my wife to join too, within a few weeks or a few months. And so I think that's kind of the best answer I can think of in terms of like, is it reasonable to be skeptic? It is, but once you realize how nice it is to, and how true it is that honestly, I mean, I carry this phone around with me all the time. A patient texts me, I text them right back. You know what I mean? A patient calls me, I'm gonna call them back. If I'm with another patient, I will get the message and I will call them back. Right. I am actually available. I am there.
You're a real person.
I'm a real person on that phone line, and I know about them and I'm watching it and they will get me. You know what I mean? Mm-hmm. They're not getting my partner. They're not getting someone else in my practice. If they called me overnight, they're not getting someone who's covering for me. They are getting me. You know what I mean? Mm-hmm. And I'm there and I know them and I care about them. And I think once patients see that very clearly, then there's nothing more appealing than that, really having direct access to your doctor.
What do you think? I want to point this out because while you are an internalist and a specialist, I don't feel like you've come across as like you're a one-size-fits-all for everything. You still have to go to these specialists and stuff like that. Yes. So talk about how it is important that, yes, you're here for us, and yes, you definitely have that one-on-one care, but you are not the one all be all for everything.
Right. So medical care is vast, and you are definitely going to need to see specialists in other areas. The field of medicine is so complex.
Oh,
you can't
isn't
be
it
an
though?
expert in everything, but it's a good kind of thing to talk about, because I think that another appeal, that I've seen for patients, and when I think about it is, so yes, you're one of only few. You have direct access to your doctor, but the other thing you have is you have assistance with navigating the healthcare system. Okay, and the navigation of the healthcare system is so difficult. Who do you see? How do I get in to see them? Like, do I have to make an appointment? Do I have to stay on the phone for 30 minutes waiting to get an appointment? What do I have? All those things. We take care of all of that. You know what I mean? So if I told you, listen, I need you to see a cardiologist, I'm going to figure out who the right person is. I'm going to schedule the appointment for you. If you're nervous about the appointment or we have special questions, I'll talk to them ahead of time. I'll come with if I can.
Yeah.
I'll follow up with you after you have the appointment. We'll talk about what happened. I mean, that is priceless. You know what I mean?
Yeah.
It relieves
of
so much
mind.
headache from having to deal with all that stuff. So
Yeah.
so we help with all that. We have 3 lovely ladies in our office that are dedicated. Their entire job is just navigating patients' health care, trying to figure out what they need, trying to schedule appointments, and they're fantastic, and they do a great job.
I feel like, is it MD squared? We take care of everything. 'Cause,
Yeah,
like,
we do.
literally,
We're trying to take care of everything. We're
Yeah.
trying to really kind of relieve the mental burden of dealing with the healthcare system, and giving you the opportunity to be your healthiest. Really being able to take care of those immediate issues, being able to take care of some of these chronic issues, stabilize them, and then really go a step further and try to make you healthy, right?
Yeah.
Try to make you your healthiest, try to make you feel good, try to help you achieve your goals.
Well, before we leave, I want to ask you, what do you and Dr. Leslie Thomas really want to do with Scottsdale and MD squared?
It's a good question. I mean, we are planning on growing our practice until we get to where we're going to stop, and we're committed to stopping, right? Where we're never going to take more than what we've committed to, those 50 families. And then we're really looking to enjoy ourselves, get to know our families, like really get to feel good, good again. I want to say again, but just really start to feel good about taking care of patients again, really feeling like we're helping them. I always felt like I helped people, but now I really feel like I can help them. I can really help them live their best life, and that's what we're looking forward to.
I love that.
Yeah.
I love that. Well, thank you for all you do.
Of
I know
course.
it's a lot, and we appreciate it, because like I said, my to-do list of dealing with filing papers and I need a new card, and that's been a hassle. Like, it's that simple.
Yes.
And it's not. So go check them out, md2.com. We'll have the information in the description of this episode. But again, thank you so much for what you and Dr. Leslie Thomas are doing. As you will hear, Shawn is our favorite real estate agent. She's always bringing in a healthy lifestyle, and that's what people are looking for as they move here. So for 25 years, Shawn has been helping and guiding buyers and sellers with straight talk, smart strategy, and data that keeps you ahead of the market. If you want a calm pro who won't let you settle for less, reach out to Shawn at 480-734-7277 or visit her at theshackletongroup.com and make your next move a winning one. If you want to stay in the loop on everything that's happening around Scottsdale, we've got you covered. You can't miss local favorites, events. Just head on over to our socials and tap into the vibe. Have a great week, Scottsdale. Keep vibing, and I'll see you around town.